Welcome, everybody, to the Policy Update webinar. It's great to see you all here. I'm looking through the names, and I see lots of new names and faces, so that's very exciting. This is your first time joining us on a webinar. Welcome. And if you're one of our regulars, welcome as well. It's always great seeing you guys each time. We'll get started with some basic housekeeping things. So our presenter today is Maron. She's our policy director. Here, as always, to bring her expertise to us all. Facilitating the webinar today will be myself. I'm Jocelyn Farrell, the program coordinator, and Nicole Chilton, our program manager for Access. Nicole Scanlon isn't able to join us today, but is here in spirit. For the basic housekeeping here, this webinar is scheduled for 1.5 hours from 10 to 11:30. It's being recorded and it will be made public on our YouTube channel. That'll be posted in about a week or so. If you would like to speak, you are welcome to raise your hand. At the end of the webinar, we will unmute people to allow you to ask questions, but you're welcome to raise your hand as we go. That way we know what order the questions are coming in at. You are also welcome to add comments or questions to the chat box at any time. We're also going to launch a demographic poll at the beginning of the presentation, and that's just to find out who you are and where you're coming from today. Our basic ground rules for today, as usual, we just ask that you honor yourself and practice self-care, model the behaviors that you would like to see in others, and then also honor your fellow attendees by assuming good intent, focusing on the issues and the facts at hand rather than the individuals. If you do disagree with people, disagree respectfully and look for areas of alignment, staying solution-oriented. And then out of respect for everybody on the call, we ask that you keep your questions and your comments brief. If there's anything else that you would like to add, any other ground rules or things for comfort agreement, you're welcome to put those in the chat. And with that, I will launch the poll and hand it over to Maron to get started.
Good morning, everyone. Welcome to the Access Year 3 Quarter 2 Policy Update. The agenda today will cover CalVoice's legislative and budget priorities. Local level entities will give us their perspective on budget advocacy. Mark Salazar will give us updates on the Peer Run Wormline regarding their budget requests in this fiscal year. We'll conclude with the gubernatorial candidate forum updates. So with that, let's start with the update on the 2028-26-27 budget advocacy. So we'll start with the May revise. So it's proposed to eliminate the 6.7 million in ongoing funding for the Commission for Behavioral Health's Community Advocacy Program. This is the only funding source to allow consumers, families, and underserved communities to participate in planning, oversight, and ongoing involvement in California behavioral health system activities. What have we done? That is the activity section, a coalition of 62 organizations, including all access LLEs, vigorously advocated to restore the fund. It was spearheaded by CBHS executive team. CalVoices, as part of the coalition, engaged in extensive advocacy with the Assembly Budget Sub 1 chair, its members, committee consultant, the Senate Budget Sub 3 chair, its members, committee consultant, Department of Finance, the full Assembly and Senate Budget chairs, the Speaker of the Assembly, and attended press conferences, etc. It was really a tough fight. Status, the final budget negotiation restored the 6.7 million in ongoing funding for the Commission for Behavioral Health's Community Advocacy Program and authority to expend 10 million from the Behavioral Health Service Fund for the Commission for Behavioral Health Innovation Partnership Fund. That was a sweet victory. As discussed, 12 of our LLEs were actively engaged in legislative advocacy to protect CBHS Community Advocacy Program. We'll hear from our two LLEs about how their involvement shaped their perspective on legislative advocacy. The two who are going to share their perspective, it's Gustavo Ayala, Interim Executive Director of Sustainable Wellness Solution, followed by Jesse Shaw, Success Over Stigma Wellness Navigator at Interim Inc. Hi, Gustavo, if you're here.
Maron, I don't see Gustavo yet.
Okay. How about Jesse?
Yeah, I'm here.
Hi,
Hey,
Jesse.
Maron. Thank you so much for inviting me to share about this. I'm really excited. It was really just a really cool opportunity to be asked to advocate in this way. It was the first time I'd ever advocated directly to a decision maker. I've done the letters before and petitions and stuff like that, but it was different actually being able to speak. And so this was on June 2nd. We met with Assembly Member Don Addis's Chief of Staff, Julie Cravato. Dawn Addis represents District 30, which covers Monterey County, San Luis Obispo County, and Santa Cruz County. And yeah, we were just, advocating to reject that revision that was going to, get rid of that $6.7 million for the community advocacy program. And we basically, what I was just sharing, we have lots of statistics, showing how important peer support is and that stuff. But really, what I focused on was the ways that our county would be impacted without these, because it's through this community advocacy program that we're able to do our recovery task force programs, which is, a meeting we do with community members in our county, talking about upcoming events, talking about this kind of legislation. Because a lot of the time, from my experience, whether it's been receiving services or providing them, um, we don't know about things until it's already done a lot of times. So this kind of advocacy is kind of I wanted to say it's like cyclical in a way where it allows us to advocate, but it also allows us to hear about what's going on. And a lot of the verbiage we hear in behavioral health is like, "Oh, your voice matters," and those kind of things. And it's that funding that makes that actually true. So that was kind of the point I pushed. And it just felt really good to be able to, and she was really receptive, and just be able to reach out. And I also let a lot of my clients know, and they signed a bunch of different. We had a whole thing where we had them sign like, if they were supportive of it, and let them know how motivated they are, and it just felt really good to hear their voice instead of just it be a placeholder for the face of the company. It just felt to see it in real life and see it happen, and to see the results of it. So I'm just really grateful to that you were given the opportunity, Maron, and I'm so glad to be part of Cal Voices. And I never thought that advocacy, I mean, advocacy always sounded nice, but to see it actually work, and it's really inspirational. And because of that, after that happened, I ended up going to do a public comment at our Behavioral Health Commission using some of that same verbiage. And now two of our board directors or board members are coming to our recovery task force meetings, because I think it's contagious, the effectiveness of that advocacy. It's so inspiring to say, hey, if this guy can do it, and we can all do it. So thank you.
Thank you, Jesse. You were brilliant.
Thank
Really.
you.
Thank you for everything you had done.
Thank you.
Appreciate it. Is Gustavo here or not? No?
I have not seen Gustavo enter yet.
Okay. So thank you, Jesse, for sharing your perspective and experience. We truly appreciate that. This is a clear testament that advocacy works. Thank you for your incredible involvement. We included one of the coalition letters sent to Senator Lared and Menjaver and Assemblymember Gabriel Addis as an example of the collective effort and dedication driving our budget advocacy work. We would like to take this time to thank CBHS executive team for their tireless advocacy to preserve the fund. Now, Cal Voices also prioritized the California Peer-Run Worm Line. The Mental Health Association of San Francisco requested authority from the Behavioral Health Service Fund of $6.5 million in 2026-27, $7.1 million in 2027-28, and $7.4 million annually thereafter to support a return to 24-hour a day, 7 days a week availability of preventive services, including bilingual and cultural competent staff provided through the California Peer-Run Worm Line / CalHope. Cal Voices and our team as a whole, we signed the coalition letter initiated by MHSF in support and provided public comments during the Senate's Budget Sub 3 hearing on 4/30/2026. We're lucky to have here today Mark Salazar, President and CEO of Mental Health Association of San Francisco. He will provide us with an update and future plan. Mark.
All right, thank you, Maren, and
Of
thank
course.
you for letting us join. And I first just want to say thank you for Access California for supporting the advocacy of Warmline funding / CalHope. As what Maren presented, we asked for a 3-year funding request that incorporates, obviously inflation and some of the restoration of services that were cut in prior years that included 24/7 access to the Warm Line, as well as the Spanish bilingual services that we've had. As you all know, with the budget was passed, and they just recently released the updated estimates for DHCS. Luckily, in there, we did catch that the Warm Line was funded for only this fiscal year. So in the May revise, they came up with just a 1-year funding gap for fiscal year 26-27, and unfortunately did not address 27-28 and so on. So that's the status right now. We're working to confirm the funding, the timeline, and updated contracts to reflect this. Again, I just want to say thank you to all of you folks for the advocacy. It is an experience. Thank you, Maren, for public comment at the state capitol. I would say for everyone here, if you ever get the chance, go speak out. Legislative folks will listen to you, as well as reaching out directly into the administration, as well as the public health agencies. Your voice, you showing up really does matter in these situations. And so fortunately, as an organization, we got great support, not only from Cal Access, but everywhere else throughout the state. So again, thank you, folks. We're glad they continued the minimal funding this year of roughly $5 million that's split between the CalHope Warm Line as well as the CalHope Red Line and our Warm Line. We're going to continue advocacy this fiscal year for the full restoration of services, 24/7, Spanish Warm Line, as well as trying to help other Warm Lines gain some funding again in the future. So that's one of our goals. It never ends, and I hope to see you all participate in the legislative process. Again, we are the representatives of this state, so again, I encourage you all to participate. Thank you, Mary.
Thank you, Mark, so much. We look forward to working with you. We appreciate and respect your leadership. Thank you. I see Gustavo entering the chat room. And so, hi, Gustavo.
Hello, yeah. I think I have some feedback.
So, if it's okay with you, I'd love to hear your perspective on the advocacy that you are a part of for the CBHS Community Advocacy Program, if that's okay, Gustavo. Are you
Absolutely.
prepared?
I am.
Wonderful.
I'm getting some echoing. I'm sorry.
It's quite okay.
Can you guys hear the echo?
Yes.
Okay. Let me see. Is that going to be problematic? I don't know if this is.
I think everybody just needs to mute.
Okay. Perfect. Okay. So today, my input on policy, what we're doing here is a little different. So my name is Gustavo Ayala. I am the current interim executive director for Sustainable Wellness Solutions. We are a peer-driven nonprofit that has been rooted in this region for more than 40 years. So we're celebrating 40 years this year. So my story begins there. Well, it didn't begin there. I'm sorry. It began with incarceration. When I was released from the jail system, I was searching for a purpose, stability, and really a second chance. I had no direction. So the opportunity came for me through YSU program at Cal Voices. That was in 2018. So what started as a training introduced me to the power of lived experience and showed me that my past didn't have to define my future. It could become one of my greatest strengths. So YSU gave me more than the knowledge I needed. It gave me confidence. It gave me purpose. And most importantly, it gave me a voice. That experience led me to become a peer support specialist, but also taught me something I'll never forget. Our voices do matter, especially when we use them to advocate for others, which is the platform that we have here. Last May, during the Access Retreat, we broke out into groups and we identified and discussed three statewide advocacy priorities. Priority number one is peer funding and housing. That's the one I participated in and gave some input. Priority two is treatment approaches. Priority three was services and integration. Listening to all the organizations in the room at that time, the same concerns continue to surface. Communities are struggling with a lack of affordable housing and limited supported services. Peer-run organizations face uncertainty around sustainable funding. Peer support specialists encountered barriers to employment, inconsistent implementation, and reimbursement challenges that made it more difficult to do the work that we were trained to do. But those weren't just policy discussions. Sorry here. As you know, I'm up here, so I have some challenges sometimes. So why is I'm sorry. So those weren't just the policy discussions. They reflected the lived experience of the people who serve every single day. Then came Governor Newsom's major revision. That's where I jumped in, and the proposed budget included eliminating $6.7 million from the Commission for Behavioral Health Community Advocacy Program. That funding, as you know, supports the infrastructure that ensures consumers, families, and people with lived experience continue to have a voice in shaping California's behavioral health system. They're trying to take that away. I was honored to join organizations across the state and signing advocacy letters and speaking up in support of preserving that funding. Because when peer voices are missing, policy decisions can lose sight of the people they are meant to serve. So through that collective advocacy, the proposed elimination did not move forward. Instead, the final budget preserved community advocacy funding and allocated $16.7 million to continue innovation and advocacy efforts for the Commission for Behavioral Health. And during those same budget negotiations, California also strengthened its investment in its housing by increasing round 7 of the Homeless Housing Assistance and Prevention, in other words, known as HAP, funding from the governor's proposed $500 million to $900 million. Those outcomes remind us that advocacy does matter. Not because one person changed the outcome, but because peers, advocates, organizations, families, and community leaders came together with one shared purpose. Policy just isn't numbers as on a spreadsheet. It's whether someone has a safe place to sleep tonight. It's whether someone leaving incarceration finds hope instead of another closed door. It's whether someone struggling with their mental health meets a peer who truly understands your journey. It's whether organizations have the resources to continue serving the communities that depend on them. So as I'm sharing my version of policy updates, I'm reminded of what is possible when people invest in peer services and believe in the value of lived experience. So what began with incarceration has led me to a life of purpose, continued education, and service. Ironically, I just started my master's in healthcare administration last Monday. So I'm in week 2. My journey happened because someone invested in peer services. Someone believed that lived experience belongs at the decision-making table. Someone chose to advocate. Thank you.
Thank you, Gustavo, for sharing that really wonderful, uplifting experience. And congratulations on your, I guess, earning a master's soon. Congratulations.
Well,
Very impressive.
I'm working toward that, so thank you.
That's wonderful. Congratulations.
Thank you.
We already heard from Jesse, so thank you. We really appreciate, Gustavo, all your tremendous participation, support, and inspiration.
Thank you.
So, Cal Voices, now we're moving to the medical mobile crisis benefits. The January governor proposal would have shifted the statewide medical mobile crisis benefit from a statewide mandatory medical benefit to an optional county benefit. Reason for the proposal, the enhanced 85% federal medical assistance percentage under the American Rescue Plan Act would expire at the end of 2026. The benefits of the programs are a lot, but just to mention a few, it provides critical behavioral health crisis service and community-based location, 24 hours a day, 7 days a week, and 365 days a year, regardless of one's insurance status. Peer support specialists are qualified members of the mobile crisis team. Just to give one statistic, 44% of adults who utilized a mobile crisis team were connected to mental health service within 30 days, and that's a good record. In terms of the activity, what we have done, Cal Voices signed a coalition opposed letter led by CBHDA, asking the legislature to reject the proposal, attended the Senate budget sub 3 on April 30th and offered public comment in opposition, worked with CBHDA closely throughout the budget process. Status, the budget maintains the mobile crisis benefits until July 1st, 2027, with 42.2 million general fund. So this particular program will be saved, but the fight is not over. The second priority that for the Cal Voices is HR 1. Though this is a federal, law, it really impacts California. I think Cal Voices provided presentation on the impact of HR 1 in the past, but for the purpose of today, we're just going to summarize what HR 1 work requirement entails. So it mandates members aged 19 to 64 covered through the Affordable Care Act Medicaid expansion with income below 138% of the federal poverty line to either work 80 hours a month, complete community service, participate in a work program, enroll at least part-time in an educational program, or any combination of this. According to California Health and Human Services, the latest number, out of the 4.4 million enrollee who will be affected by HR 1's work requirements reporting, projected disenrollments are 43,000 in 2026-27 and 1.1 million by 2029 and 30. The Medicare and Medicare Services, CMS, issued an interim final rule on June 3rd, 2026 to provide states with a preliminary guide to implementing HR 1 work reporting requirement, which take effect on January 1st, 2027. HR 1 excludes medically frail individuals from work requirement. Among others, this includes person with a substance use disorder, with a disabling mental disorder, with a physical, intellectual, or developmental disability that significantly impairs their ability to perform one or more activities of daily living. So the CMS interim final rule defines medically frail as conditions that impair an individual's ability to work. And this is pretty vague, as you can see. This makes it difficult for state to use automatic renewal using existing database. Requires state to use diagnostic codes and reliable data to grant exemptions for medically frail individuals. The data must be auditable and verifiable. Required state to engage in outreach and provide accommodations for applicants and enrollee. State Health and Strategies, a program of the Robert Wood Johnson Foundation analysis highlights that the medical codes and claims do not provide information about individuals' ability to work, making the current state list ineffective. They anticipate the following potential consequences. They say state will face significant challenge meeting the January 1st, 2027 implementation date and complying with the rule. States, providers, individual will face increased administrative complexity. Eligible individuals may lose coverage if they cannot readily access a provider or obtain the required documentation, regardless of the severity of their medical condition. So CalVoices shares state health and strategies foreseeable challenge. It's precisely why CalVoices engage in budget advocacy for fiscal 2026 and 27 to include certified peers alongside navigators to assist with medical eligibility, enrollment, and retention, and to leverage their efforts for outreach and engagement with clients affected by HR1. What CalVoices specifically asked is for the 2025-2026 request to add statutory authorization to include peers in the current year funding of $15 million for the state and county communication campaign and implementation effort for 2026 and 27 budget proposal to include peers, and the proposed governor's budget, which allocated $4 million for navigators to assist with medical eligibility, enrollment, and retention. While the legislator did not specifically include our request, the budget includes for medical eligibility, it provides $197 million general fund in 2026 and 27 for county eligibility workload related to HR1 work requirement. For CalFresh eligibility, it provides $223 million general fund for counties to implement HR1 for able-bodied adults without dependents. These are between the age of 18 and 64 years old, do not have dependent child under 14 years old, are considered physically and mentally able to work at least 20 hours per week. And so this BAWDs apply to those individuals, and the state has provided $223 million to the counties so that they can comply with the HR1 requirement. So what is CalVoices' next advocacy strategy related to HR1? CalVoices will engage CBHDA to explore how peer support specialists can be deployed as navigators across the counties, potentially tapping into the $420 million general fund allocated to counties for medical and CalFresh eligibility activity related to HR1. CBHDA has been a phenomenal partner and will provide updates as they are available. That concludes CalVoices' budget advocacy, and now in the next section, we'll discuss highlight some of the CalVoices priority bills. We'll start with AB 96 Jackson. Most of you are familiar with this. It's sponsored by CalVoices and CBHD. It would eliminate the requirement that applicants have a high school diploma or equivalent degree to become a certified medical peer support specialist. The recent activities, a coalition of 21 organizations, including all our LLEs, submitted a support letter to the Senate Health. This is in addition to several organizations and counties that submitted their own support letters. Don Morrison, Peer Service Program Manager at Youth for Change, and Sacher Yuba Behavioral Health testified in the Senate Health Committee. We'll hear from him shortly. So the status, it passed the Assembly with unanimous support, the Senate Health Committee, and got out of the Senate appropriation with 28.8. It is now on the Senate floor. Don Morrison, if you're here, we'd love to hear your experience as a witness.
Hi, Marin,
Hi.
and everybody here. Well, the experience was great. I was given about 2 minutes worth to present this towards the Senate Health Committee, and let's see, the other person that presented with me, I can't remember.
Amir.
Amir, and I can't remember what agency he's with. But,
CBHD.
yeah, okay, yeah, and so he presented right next to me. We sat at this little table in front of the Senate Health Committee panel, and my statement was basically that I operate a wellness and recovery center, and besides the fact that I think they were all aware, the Senate members, that peer support is an evidence-based practice. I went further to say that we work with participants in our wellness and recovery program that don't have high school diplomas or equivalencies that would make fantastic peer support specialists. So I've, personal experience, I see it here. And that was my basic testimony. The whole experience was great because you get to see a little bit, a peek into what goes on in Sacramento in the legislature, and it's a busy place. There's a lot of folks, sharply dressed folks, power walking around everywhere. So that was fun. But anyway, Marin, did I answer that question?
Absolutely.
Okay.
You were a phenomenal witness. Thank you so much for coming, participating. We appreciate you very much, Don.
Thank you.
And thank you all for signing the coalition letter, and again, Don, for testifying. So the CalVoices regarding AB 2138, Correll, we have a support position. Just to give an overview of the Enhanced Care Management program, it's a statewide medical benefits available to individuals with complex needs, including individuals experiencing serious mental illness, substance use disorders, homelessness, and justice involvement, to address their clinical and non-clinical needs through coordinated service and care management. ECM services are provided by community-based groups that have contract with medical health plans. So AB 2138 was sponsored by the Steinberg Institute. The bill would require ECM providers serving more than 50 patients, if at least 25% of their caseload consists of adults with serious behavioral disorder, to include at least one certified PSS as part of their interdisciplinary care teams to integrate PSS into ECM teams. It would ensure that PSS are not automatically excluded from employment due to criminal background checks by requiring ECM providers to assess each applicant's lived experiences relevant to the job they are applying for when making hiring determinations. It would preserve the federal Medicaid screening requirements and maintain exclusion for serious violent and child-related felony convictions. Activities, CalVoices work with Steinberg Institute closely on possible amendments. We initiated a coalition letter, which was signed by Sunrays of Hope, Campro, Interim, and Painted Brain, and was submitted to the Assembly Health Committee. On May 13, 2026, Rachel Chambers, Executive Director of Painted Brain, testified at the Assembly Health Committee hearing, and CalVoices offered me too. Status, unfortunately, it's held in the Assembly Appropriation Suspense file. CalVoices reached out to Steinberg Institute to ask whether there is a plan to reintroduce AB 2138 in 2027. We learned that no decision has been made yet, and we'll keep you posted. CalVoices has a support position for AB 1626, Gabrielle. The bill would require youth sports coaches to receive mental health training to help them to recognize signs of distress, facilitate supportive communications, and connect them to school and community services. This is an important bill because coaches spend considerable time with student athletes and are uniquely positioned to provide support. Sponsors of this bill are Mental Health America of California, the California Youth Empowerment Network, the California Alliance of Child and Family Services. CalVoices signed a coalition letter in the Assembly and Senate at various stages of the legislative process. Status is Assembly concurrence and the Senate amendments. Basically, they are reconciling the amendments and will be sent to the governor for his signature. AB 1540 Gonzalez, CalVoices has a support position. Since 2022, the 988 hotline provided specialized services to prevent LGBTQ plus youth suicide until the government cuts its funding in July 2024, which prompted SAMHSA to terminate contracts with service providers. As amended on March 19, 2026, AB 1540 would require the Office of Emergency Services to request SAMHSA to enable a press tree function for 988 calls originated in California to direct them to a specialized call center. Within 12 months of approval by the federal government, CalHHS is required to identify and contract with entities that specialize in LGBTQ plus suicide prevention services. This is critical suicide prevention services for LGBTQ plus population. The data is according to a report published by the National Library of Medicine on November 27, 2025. LGBTQ plus young people continue to face disproportionately high rates of suicide thoughts and behavior compared to their heterosexual peers. And this is not unacceptable. This service could be funded through the 988 surcharge on end user access lines, such as cell phone or home phone lines. CalVoices submitted a support letter to the Assembly Health and Assembly Communication and Senate Committee on Health. Status, it's on the Senate appropriation calendar on 8/3/2026. No doubt it will move out of the Senate appropriations because a funding source has been identified. AB 2126 El-Hari, CalVoices has a support position. The bill would require the California Department of Social Services to grant a background check exemption for former or current foster youth. This is for those with non-violent offenses occurred before age 21 to be employed in a peer support capacity in facilities governed by the Community Care Facilities Act. That is a foster family agency provider, a short-term residential therapeutic program provider, a community treatment facility provider, or a group home. It would allow current and former foster youth to work with foster youth to help them identify and express their needs, advocate for their rights, and actively engage in their care plans to develop life skills, build resilience, and foster self-advocacy. The sponsor is the California Alliance of Child and Family Services, Children's Partnership, Child Welfare Director Association, and the Alliance for Boys and Men of Color. Activity, Cal Voices submitted a support letter. Unfortunately, it's held in the Assembly Appropriation suspense file because the estimated ongoing general fund costs are likely to be in the low millions. AB 2003 Berman, Cal Voices' support position. The bill would require the Behavioral Health Service Oversight and Accountability Commission, in consultation with California Department of Education, the State Department of Public Health, to develop evidence-based free online training. It would create a sustainable statewide suicide prevention infrastructure to train school staff, students, parents, and guardians, and caregivers from California K-12 schools. This program is evidence-based, trauma-informed, and culturally and linguistically competent. This is critical to reduce the suicide rate among youth in California. So activity, Cal Voices submitted a coalition support letter to Assembly Education and Senate Education. So all the organizations who signed the coalition are listed. I will not read them here. Great news. It's chaptered, signed by the governor and chaptered, so it's a law. This is one of my favorite bills. It's AB 1932 El Hari, and we have a support position for this. It would extend the sunset date of the Community Response to Strengthen Emergency System Act, administered by the California Department of School Services from June 30, 2026 to January 2023. In summary, basically, it was supposed to expire. Now it's extended by another 3 years, which is great. The bill directs CDSS, along with the stakeholder group, to establish eligibility criteria and award grants to CBOs, removing the previous requirements that local government act as a liaison. It would extend the definition of community-based organization to include nonprofit organization and define grantee to mean a community-based organization rather than a local government or tribe. This bill is intended to provide funding to CBOs, like peer-led organization, to strengthen and sustain community-based response measures for people experiencing mental health or substance use crisis. The bill would authorize the department and the stakeholder group to award at least $250,000 to community-based organization for designing and implementing their own emergency response system. So for activity for Cal Voices, we submitted a support letter to Assembly Human Services, Assembly Judiciary, and Senate Human Services, met with several California legislators and their staffers to advocate for its passage during the Black Leadership Council Advocacy Day on June 17, 2026. We also met with Assemblymember El Hari to thank her for authoring this bill and for her leadership. Status is in the Senate suspense file. We are hopeful that it will get out of the suspense file as it did in the Assembly. This is really a fantastic bill. AB 1669, Pacheco, we have a support position. It would require post-secondary education institutions starting in 2027-28 academic year to support a written policy allowing students facing mental health challenge to take voluntary medical leaves of absence for a period to be determined by the institution or for a longer period of one academic year. It would ensure that students are not required to withdraw or reapply upon their return by providing an equitable path for recovery and motivate students to prioritize their well-being without the fear of falling behind academically. This policy recognizes that mental health is vital as physical health and encourages students to seek help to achieve their educational goals. It's sponsored by the University of California Student Association status. CalVoices submitted support letter to Assembly Higher Education and Senate Education, currently in the Senate appropriation calendar for 8/3/2026. SB 1242 Chow. We had an opposed position and now it switched to neutral. As it was introduced, the bill would make the family member the default supporter in the care proceedings, removing the respondent's right to choose a supporter they trust as outlined in the law and undermining the voluntary nature of the care process. Under the existing law, a supporter can be a family member selected by the respondent to carry out their will and preferences. The sponsor is Conference of California Bar Association. They claim without any evidence that the respondents suffer from neurological impairment that causes distrust and paranoia toward their family members. We asked for evidence, as I stated, and we have not seen any. Activity, CalVoices, DRC, MHA, and Campro met with the author's staff and sponsor to discuss concerns. Initially, due to lack of agreement, CalVoices submitted a opposed letter to Senate Health and Senate Judiciary. Fortunately, we received amendment from the author's office, which were published on June 17th. That amendment significantly watered down the bill, simply clarifying that family members can provide information one way to county behavioral health without the consumer consent, which is already permitted. With that, CalVoices switched from opposed to neutral position. That concludes our presentation highlighting some of CalVoices' priority bills. And we switch to gubernatorial candidate updates. As most of you know, the Black Alliance Gubernatorial Candidate Forum took place in San Francisco on February 3rd, 2026. The key issue prioritized in the questionnaire for the candidates to respond include all this listed below, including the health equity and behavioral health. CalVoices has taken the responsibility of focusing on California's state of the behavioral health workforce, highlighted the following issues as top priorities: expanding and prioritizing peer support services, increasing culturally appropriate care through workforce diversity, targeting medical investment towards equity, increase medical reimbursement. So, as you know, all the major candidates were present, including Becerra, Democrat, and Steve Hilton, Republican. Based on the responses for the behavioral health workforce, the scoreboard based on the questionnaires on our priority area, particularly peer support services, Becerra scored strong and Hilton weak. We already submitted, I think, distributed the response to all our questionnaires publicly. And for those of you who have not received yet, happy to share those with you. Post-primary, what accountability looks like. Regarding peer support, Becerra submitted in writing his commitment to make peer support service a statewide medical benefit. This is a tremendous opportunity to move PSS from a county optional benefit to a mandated statewide cover benefit. Fortunately, CalVoices has submitted a legislative language to the Behavioral Health Commission for their consideration to sponsor a bill towards that goal. CalVoices plans to follow up with Becerra campaign to urge him, should he become the governor, to make peer support services a statewide medical benefit within the first year of the new administration. We'll reach out for your advocacy in the coming weeks. Key gubernatorial dates, Becerra, Democrat, and Steve Hilton are running for governor. The election is on Tuesday, November 3rd, 2026. This concludes CalVoices Year 3 Q2 Quarter 2 policy update. I'll pass it to the Access team, and thank you so much for your time.
All right. Thank you so much, Maron. Looking at the chat here, I know that there were a number of conversations or wondering if I can bring one question to you that stands out that may need some clarification. And it was related to, I believe the slide was about AB 96. And the question is, how would this affect federal billing, since federal billing requirements include a diploma? Also, it says the degree bias peers already are up against without a basic diploma or GED stigma will increase further about peer ability to provide services on interdisciplinary teams.
So regarding the federal issue, no, it would have no bearing. This is the, we already had a discussion with Department of Healthcare Services, and so no, it's not going to have any impact. Regarding the whether this is going to undermine the overall peer and how they're viewed because a high school diploma is removed. CalMesa had conducted analysis, a questionnaire, and so many certified peer support cited the diploma as an impediment because of difficulty to be able to get their high school diploma because of year past, or because of the condition they experience, unable to complete high school, yet they meet all the requirement and the competency to be able to be certified and provide services using their lived experience. And so actually there's all net benefit with no disadvantage whatsoever. And in fact, so many wonderful individuals with lived experience can draw those experiences to be able to advocate and help others too to succeed.
Thank you, Maron. And Jesse, I see you have your hand up.
Yes, thank you. I just had a question, kind of general. All these slides, can we have these sent to us? Because I'm doing my recovery task force meeting tomorrow, and I want to bring this to all my peers and just not only to show like what they can advocate for, but what we've already done. And I would love to. You broke it down really well, so thank you, Maron. I just would love to have those slides.
Yeah, the Access team will share this with all of you.
Yeah,
Thank
Jesse,
you.
would you mind sending me an email? These will be public on the YouTube channel, but not in time for that. So if you send me an email, I'll get that to
Okay.
you today.
Thank you.
All right. Hi, Kimberly. I see your hand.
Yes, I had a question for MHA San Francisco. Are they still here?
Peter, Mark. If they're not here, Kimberly, there's no problem. You can
I'm here. I think
you're
Mark
here.
is too,
Perfect.
but this is Peter.
Hi, Peter.
Hi.
I know that you guys have a robust hoarding program, and I'm wondering if those budget cuts have impacted that at all.
Uh, Actually, it's funded separately. We did
Okay.
lose a bit of the funding, but that was through it's through San Francisco, the city of San Francisco. So, but yeah, the program is still going pretty strong. Yeah,
Yeah, it's a wonderful program. I recommend
yeah,
it all the time. Thank
yeah.
you.
Thanks, Kimberly.
Okay, and
Peter,
then
it's
I
so good to see you, and thank you for all your amazing advocacy.
Thanks, Moran. You've been a great help, and it's wonderful to collaborate with you and the others we've met as well. So, thanks very
Absolutely.
much.
all right, and we have just one last hand or question or comment. Zuri, I see you. Oh, they put their hand down. All right.
Yes, yes. Thank you so much. And thank you so much for having this forum. Moran is so fantastic. I actually was blessed to be in a cohort, and she did a lot of great training. And because of that, the opportunities that are available, specifically, I would say for everyone, but those who may need culturally responsive services and support that, there has been a component with Moran assisting with that piece of it. And one of the proposals we had was a peer support navigation. And we were intentionally looking at where there has been an omittance of behavioral health, or I hate that word, but wellness supports, specifically for Black women and families that more than half do not access those services. And she was able to help me with a proposal that we were doing. A part of a cohort. And I was interested in that peer support navigation for those who may have limited opportunities, but have the skills, have the background, have the lived experience, but also connect folks to resources and supports specifically and intentionally with that in mind for our Black, Brown, Indigenous community members, and what's open for that, maybe at Cal Voices or on a statewide level, if we're already doing the work. And I just put a little information in the chat on what we did. What one of the areas that we worked on, besides delivering, generating hundreds of newsletters every week with basic needs, just well-being supports, including Cal Voices, some of the great workshops and trainings, housing. In every area, our families and Black people are impacted by the disparities. Black women specifically, who traditionally are the head of households, with some of the legislation and denial of supports and resources. So I know that's a lot, but I just want to thank Moran, who does a fantastic job, and Cal Voices that continues to amplify the needs of our community and those who may not have, regular access to supports. And I
Thank
put
you.
it.
Thank you, Zuri. We definitely would love to have a conversation about your specific comments. The greatest thing about peer support specialists, they're very diverse, truly represent California. There's 16% are also Black. So for the specific concern you raised, we should definitely schedule a time and chat and how we can move it forward. And thank you for sharing your thoughts.
I think there's another question in the chat. Did Angela's question get asked? I had to step away for a quick second, and so I apologize if it already did get asked. But asking how is Cal Voices supporting or promoting federal legislation?
So HR1, the one we just discussed, is a federal legislation. So we're monitoring. We don't have the capacity to fully engage in all the federal, but you know, we are looking at federal, legislation that are critical, such as HR1, and we do have partners with Mental Health America of California. We collaborate with them also at the state level. And so, yeah, we're monitoring, but the 90% of our focus is states due to capacity.
Katrina?
Yes, I wanted to inform you guys that we, Jesse and I will be doing a presentation at the California Behavioral Health Planning Council in South San Francisco in October.
Thank you.
And we will be using some of this material to talk about what it is that we want and need. And so if there's any information, anything that comes up, please try to get it to Jesse and I before that October date, and we can we'll be able to put it in our stories and talk about it with that council.
Thank you for sharing your future plan. If there are any specific needs that you have from Cal Voices and Access, we're here to assist.
Thank you.
Jonathan, go ahead.
Hi, can you hear me?
Yep.
What I'm finding to be a major barrier to being a peer support specialist is the requirement to have a valid California driver's license with a clean driving record and clean ability to get perfect insurance and have your own personal vehicle. Because most people, I would assume, if they are trying to become peer specialists, they don't have those requirements or they don't meet those requirements. And so a lot of people don't have their own cars. And so I don't understand why for me at least, over the last several months, every position for a peer specialist says you have to have those as requirements.
Thank you, Jonathan, for raising this important issue or area. Let's look into that and get clarification why that is the case, and we'll email you what we have gathered or uncovered.
Thank you.
All right, Marilyn, I think that's everyone. Thank you all for joining us. Joss, did you have anything to add?
I do not. Just thank you all for being here today. It's great seeing you all. And we'll have this up on our YouTube channel in about a week or so, along with the slide deck.
Thank you, everyone.
Thank you all.
Thank you.
Bye.
Bye, Mary.
Thank you, everyone. Bye, everyone.
Bye.